Welcome back to continue our discussion talking about blood and blood services. Joining me again is Dr. Mei-Ching Fusi with the American Red Cross, Medical Director of the Southwest region. Let's jump in. Now, we were talking about criteria, and we were talking about the weight and height and how it can vary by age, and you have the charts that kind of help us know, and the capacity being, you know, up to 300 pounds or so. It just depends on the equipment you have available. So people of all sizes can contact the Red Cross to consider and talk about their donation possibilities. What are some other criteria? What if a person has a cold or a slight fever? Talk about some of those kind of criteria.
Well, actually, we do a blood pressure check, a heart rate, and a temperature, and the most important is what we call an iron count. Okay, so we'll take a little drop of blood from your finger, and we'll test it to see if you have enough iron in your blood to donate safely. Because the last thing we want to do is to make someone anemic. Okay, so that we definitely do check. Now, if you have a temperature, we will also defer the person because we want someone to be healthy. And the next piece that's a really huge piece is what we call our health history questions. And the first question is, hey, are you feeling well today? Because if a person's not feeling well, we don't want them to donate, obviously. So the very first question we're going to be asking you is, how do you feel? You know, I mean, we're not going to ask it that way. We have to, in fact, what we use now are laptops so that the donor can actually sit in front of a laptop and answer the questions on their own.
Now let's say if it's a person who's not very computer savvy, there are still people out there like that.
We have an option.
Is there a person that will help with that phenomenon?
Yes, our staff do have the option, if a donor asks, to actually read the question and have the donor answer, and then our staff will be the one marking the answer, yes or no.
Now you mentioned that you screen for blood pressure. Now we know that blood pressure is a big issue within our country. What's sort of the safe range of blood pressure, or is there a point in which you say that's too high, we cannot do this? I mean, what criteria do you look at there?
Yeah, we do have some cutoffs. We actually have a blood pressure cutoff at the bottom end as well as the upper end. And the numbers I couldn't even begin to tell you because I never keep those facts in my head.
Right,
you know, it's just that I know that there are criteria. We certainly don't want to make anybody worse off than they are, especially someone who's running a low blood pressure, because by taking blood, you could lower the blood pressure even more into a danger zone. So, as far as a higher upper end cutoff, as far as the medical standpoint goes, there probably really isn't any very good reason to do it, but we feel that we kind of do this as a public health sort of measure, that if their blood pressure is high, we want the donor to know to not donate blood and to go have that checked out.
So, you know, in fact, you may be one of the first sort of healthcare entities where the person may find out they have high blood pressure potentially and refer them for further testing. Let me ask another question. What about people that may have some type of chronic health condition, such as diabetes or asthma, things such as that? Can they safely donate?
There's actually a lot of medical conditions a person can have where they can donate. And that point that you may safely donate, that's what we look for. Okay, so our questions encompass a number of different things. We ask about certain medications to see if the condition that you're getting that medication for is a reason for deferral. We ask about antibiotics specifically, because what we don't want to have somebody donate blood is someone who's infected and then can transmit that infection through the blood donation. Okay. The conditions you mentioned, specific diabetes and asthma, if a person is taking medication for, say, either of those entities or any other condition, I mean, we have people who have multiple sclerosis that donate with us safely. You know, so there's a number of all sorts of medical conditions. As long as they're well controlled on whatever medication that they have and they're not acutely ill, that usually will be fine.
Now, in those situations, does the individual have to bring something from their physician, sort of indicating that they're in general good health, or do you just take the person's word for that?
We take the person's word for it. So we don't need a specific, like a medical release. We don't do those sorts of things. However, what we sometimes will do is, if a person says, oh, well, you know, I did have this, that, or whatever, and it's still being worked on, what we'll advise a person is we'll have to defer them from donating to go back to his or her physician and find out exactly what is going on and whether or not they can donate. So we will ask the person, him or herself, to check with their own physicians.
Now, what about people who are going to receive the donated blood, and they may have questions too in terms of the safety of the blood that they're receiving. So let's say if you have the diabetic person and they're on insulin, or you know, you have others that are on medications, the person may say, well, I don't want blood that has all of these things within it. So what happens with that?
I hear what you're saying. What's interesting is when you take a medication for whatever it might be, diabetes, asthma, whatever it is carried in the blood. So yes, the potential is that you could have a donor taking a medication. In that unit of donated blood, that drug will be there. However, what ends up happening is that when you look at it from a medical standpoint, the amount of medication in a unit of blood, and this would be mostly a blood, the plasma portion, the clearer portion of the blood is where the medication usually is. That amount of medication is not going to have a significant influence on the person receiving it. Does that make sense?
Okay.
You know, it's not like they're taking the drug directly. This drug has been taken by the donor. We're only taking a piece, a small percentage of that individual's blood that has that drug. So we're talking about, you know, like maybe 10% of what the person took that's actually being transfused. And the amount is considered to be insignificant.
Okay. Now, are there certain kinds of drugs that persons can be on that you would not see them as being appropriate donors,
Yes.
a certain classification of drugs?
Yes. In general, if you're familiar with the FDA, what they do is they have to approve all drugs that are sold in the United States. And there's categories of safety. There are certain drugs in Category X. And those Category X drugs are the ones, and I can't say that they're all reasons for deferral, but many of the Category X drugs is a cause for deferring a person.
Okay. Would that be drugs such as if you're on heavy-duty drugs like morphine or
Actually, no. It doesn't
not morphine,
include those.
doesn't
No.
include morphine, Demerol, those
No,
kind? Okay.
believe me, there's a lot of people who are probably on those drugs
Right,
that are
right, that
donors.
you
Because we
would-
don't ask specific for those drugs. Some of the drugs, in fact, there's a whole class of drugs that is a reason for deferral, and that's individuals who are male who are taking this drug for like benign prostatic hyperplasia or hypertrophy. And that whole class of drugs causes deferral for anywhere from several months to years.
Okay.
The other drug that is also a cause for actually what we call indefinite deferral is anyone who's taken a substance that is used in the treatment of certain skin conditions. And it's a vitamin A derivative.
Okay.
And that's reason for indefinite deferral.
So if a person is on medication to help them to sleep, they're on a prescriptive sleep medication or taking something over the counter, those are not going to be reasons for any type of deferment. They can still participate because the individual is going to get very little of that in the transfusion process.
Right. So it's felt to be not a recipient patient safety issue.
Okay. Now some people may wonder, well, you know what, Doc, I'm going to take a really quick break. I see that my time is needing a break here, so I'm going to take a break, and then I'm going to come back and ask you about, people may be wondering about these drugs. If you have persons who are known to be on drugs as far as illegal substances who maybe come in and want to donate, how do you look at that? Okay?
All right.
All righty. Please stay with us. We'll be right back.